My name is Robin Gorel. I'm the Care Management Director with Assisting Hands Home Care. I have 25 years of senior care experience. I've taken care of dozens of patients with Parkinson's. Here at Assisting Hands, we have quite a few clients with Parkinson's disease. This work is also particularly meaningful to me as my grandfather had Parkinson's disease as well. So I know firsthand the impact that it has on patients as well as their families. Parkinson's disease is a neurodegenerative disorder. It leads to movement-related symptoms such as tremors, stiffness, and balance issues. So, of course, one of the early signs we all know about is tremors, but one or others that are less common could be loss of smell, sleep disturbances, and stiffness in the limbs. My grandfather's first symptoms actually were a slight tremor in his hands, and he had a lot of headaches. And that's actually what took him to the doctor and led to the Parkinson's diagnosis. Actually, genetics only account for 10 to 15% of Parkinson's cases, so that leaves 85 to 90% not related to genetics at all. Actually, yes, they do. Hormonal differences, particularly related to estrogen, play a significant role in the disease's presentation and progression in women. Women actually experience a later onset with more non-motor symptoms like depression and cognitive decline. They're also at a greater risk of sleep problems and have a more variable response to medication, where men tend to develop Parkinson's disease earlier and experience more severe motor symptoms that may actually progress more quickly in the early stages. So Parkinson's disease does progress through stages. It is a neurodegenerative disorder. So if you think about your brain being left and right-sided, a lot of times it does start on one side before advancing to both sides of the body. It can also affect your balance and your daily activities of living. So, a Parkinson's diagnosis is devastating, absolutely, but it's not fatal. It's not a direct killer like you would think of, like a stroke or a heart attack. But that being said, a lot of it really depends on the quality of care that you receive from your medical team and from yourself. So, as the disease progresses, of course, you're really vulnerable to falls, which is a great time to think about other people that could be of assistance to you in your home, like a home care company. So when we come in, we can do an assessment and screen for potential risk factors in the home, things that could be a trip hazard. Our caregivers can also help do your exercises. Very, very important as the disease progresses to stay active and keep moving.